It is time for News Extra today. I'm Dennis Ernest, in for Kevin Mooney. We are joined by Paulette Schnell from Community Health and John Nygard with Regional West Pharmacy Services. And good morning to both of you.
Good morning.
We are on the cusps of the flu season, I guess, huh? Paula, what's the latest on the flu outlook? We're starting a little early this year, right?
Well, they've done enough studies now to show that the vaccine can actually cover throughout the whole year. And so the recommendation is to start giving that vaccine as soon as the vaccine's available. And so we have ours in, and we're preparing for this Saturday.
All right. And the flu vaccine covering the gamut of what we think is going to be the flu this year.
Right, and the vaccine that we'll be using Saturday is what's called trivalent, and that there's 3 different kinds. It's not a live virus, it's an injection. And we'll be targeting Medicare age people for Saturday.
For Saturday, and that's the drive-in flu clinic, right?
Right.
We'll get to. Let's visit a little bit more about flu shots in general, and then we'll get to those specific events. Who should get a flu shot?
Basically anymore they recommend anybody. Who does not want to who wants to protect themselves?
Who wants to get flu?
Who wants to get flu, basically. And anymore you can get fairly sick with flu, and you don't know if you're going to be the one that's home a few days or one that's home a couple of weeks or ends up in the hospital. So taking the precaution.
Or the one home taking care of that other person.
Exactly. And as adults, we have a responsibility to take care of the ones around us that can't get the flu shot, which are those babies under 6 months, or maybe some of those people that are have a compromised immune system problems or health problems that prevent them from getting it.
Okay, so pretty much everybody.
Yes.
Except for the very, very young. All right, John, how about supply? How does this fit into what you do at pharmacy?
Well, we are very fortunate at Regional West to have our supply in early, and we're stocked up and we're ready to meet the demand. We've experienced no supply issues whatsoever.
All right, so on Saturday, Paula, what's our schedule? What do we got coming up?
From 8 to 11, up at the main part of the hospital, main campus there, North Campus, we'll be doing the drive-through. It's targeted at the senior citizens. A couple reasons for that. One is that it just makes it so handy for them to be able to just get into the car, drive through and get that, not have to do some walking to get out of the car, walk, stand in line. So it makes it very nice for them. They just need to have their arm ready to go by a window and to do that. And then also for billing purposes, when we're working outside, we can take the Medicare number very easily and do that. So there's a couple reasons why we aim at that group. And it's good for them to get that early so that they are covered, because they are one of our more prone populations for the flu.
Okay, so the drive-through primarily targeted for those seniors. Bring the Medicare card.
Right, and it's from 8 to 11.
Yes, and ready to go.
And ready to go, yeah.
Even though it may be cold.
Well, I think the weather's going to straighten out by then. I think we're going to take a little roller coaster between now and then, but I think it's going to straighten out pretty decent by Saturday, so that's good news. But you're in the vehicle anyway, so even if it's a little chilly that morning. All right, so then after the drive-through clinic, what do we got coming up?
Well, on September 27th, which is 2 weeks later, at the St. Mary's Plaza Community Health, from 8 to 11, we'll have our normal flu clinic, and we welcome adult, children, and families. And wheelchairs are available for those who need assistance to get in the building, and we'll have all varieties of the flu vaccine available upon request. So not only the injection, but we also have a flu vaccine available for people that are allergic to eggs. People in the past have always shied away from it if they've had an egg allergy. So this year we do have a product called Flu Block, and that'll be available as well.
What's a little off topic but related in a way? How about pneumonia? Should we be getting those pneumonia shots if we're out of date with those?
We will be offering that on the 27th of September, and anybody 65 and older are recommended to get one. And then those that are under 65, if you have some health problems that your doctor would recommend it, usually we look at diabetics, people who have a history of pneumonia or other lung problems, definitely, or heart problems, we recommend the pneumonia shot. And that will be available on the 27th.
On the 27th. And are those annual, or is that good for 4 or 5 years? Or?
One for after the age 65 and one before if your doctor would recommend it. And then some doctors will recommend for those people who are 65 every 5 to 10 years maybe, but no sooner than 5 years.
It's certainly not an annual deal.
Right.
Right, okay, very good. All right, we'll come back and wrap things up right after this.
On the welfare caseworker,
What else?
And I should have caught you, it's Paulette, not Paula. That's okay.
Hey, it starts with Paul, I'm okay.
That's okay. People call me Joni all the time, so I'm kind of.
And that one, the one on the 27th, we take anybody, cash, check, insurance card, they'll bill the insurance.
News services and aired in cooperation with the Nebraska Broadcasters Association and this station.
On the News Extra, talking flu season and the drive-in, drive-through flu clinic coming up on Saturday, 8 to 11, Regional West South, and that's for primarily the Medicare patients. Bring that Medicare card. John, on the 27th, cash, other insurance cards, or if you do have Medicare, bring those, right?
Right, plus if they have other types of insurance, we will bill the insurance as well.
All right, very good.
That will be located down at St. Mary's Plaza, and the 27th, and then on the Saturday it's up at the North Plaza.
Right.
So.
Okay. Very good. Anything else we need to talk about on that?
Well, I think that's it.
It's
except-
painful, right? I mean, it hurts a lot, and you just feel
Oh,
terrible
no.
afterwards, right?
You hardly even know you get it, because we're really good at it, and I have some ready for anybody who wants to get one today.
Bring it on.
Okay.
All right, I've already had mine and
You're good to go.
experienced no side effects.
No side effects, and no pain, no lingering.
No pain whatsoever.
All right, very
Matter of
good.
fact, I had a student give me mine, and she was wonderful.
Good. And it's a good thing to get done, and try to prevent problems down the road, and stay out of the hospital with it. John, how long have you been with Regional West?
I joined Regional West at the end of April, so I'm a relative newcomer to Scottsbluff.
How do you like it?
I like the area very much. Hospital is very
I think
friendly.
Paulette over here, by the way, Paulette
Um,
just gave him a shot.
We're changing a lot of things, updating, and
Yeah.
making it a better experience for the patients that have to come to the hospital.
So you're in charge of the hospital, in the hospital itself for the pharmaceutical needs, as well as the public store?
That is correct. I have oversight for both. And we do have pharmacists that go out to the outlying communities, Bridgeport, Oshkosh, and Garden County. So we have relationships with them as well, and we support them.
Very good. Paulette Schnell with Community Health, John Nygard with Pharmacy Services at Regional West. Thanks for coming by.
Thank
Thank
you.
you.